Hello, my name is Mitch Mitchell of TT Mitchell Consulting Incorporated. We are a healthcare finance consulting company that concentrates on revenue integrity. Basically, it's charge master, charge capture projects, and denial management. We do a few other things as well, but today I'm going to talk about charge master. I've noticed that there's really no other videos on YouTube right now that talk about what a hospital charge master is. And since this is something that I do and if you look on Google and you look for me, look for TT Mitchell Consulting, or you look for Mitch Mitchell, or you just look for Charge Master Consulting, I will be listed in the top 5. So at least Google thinks that I know what I'm talking about. Let's see if I do. So what is a hospital charge master? Well, just to get this part out of the way, it can either be one word as charge master, or it can be 2 words. I've seen it both ways. It doesn't really make much difference. Basically what it is, I like to refer to it as it's the respiratory system of a hospital. And actually, when you get right down to it, it's respiratory system of physicians' offices and clinics and everything else. What it is the listing of all the charges that a hospital can bill you for. So it's every procedure, every supply item, and every pharmaceutical. And there's a little degree when we talk about every single procedure, because in some hospitals, they bill out surgical procedures based on time, and they let medical records do the coding on the back end. Now, you're probably asking, why do hospitals have this? Well, basically, it's a big database. And the purpose of having this database is to make charge capture easy to do. There's all kinds of different codes that go with these. I mean, you need charge codes, which are basically the identifying codes that hospitals use. You have procedure codes. Another word for that is CPT codes. We are in a system where we have CPT-4 and CPT-5 codes. We have HCPCS codes, which are they're 5-digit codes, and these things will denote, different procedures that are done. We have pharmaceutical codes. The pharmaceutical codes will begin with a letter and have 4 numbers after it. Some of the supplies have codes. So you have these codes. You have revenue codes. Now, revenue codes basically tell whoever it is that you're billing what area of the hospital a service might be being done in, or the type of service. There's a lot of these kinds of codes here, and they stand for anything. Different types of radiology codes, different types of lab codes, different types of surgical codes, all kinds of codes. And these become important because sometimes when hospitals are negotiating with insurance companies, an insurance company might decide that if you use a certain revenue code, that they will reimburse the hospital more or less than using another code. For instance, you look at something like cardiac cath. Now, cardiac cath is basically in the range of a 410 range, as opposed to a general surgery, which is 360. So an insurance company may say, well, if you do these cardiac procedures, and actually it's probably not a cardiac cath, but I'm just throwing out an example of the type of thing that could happen. They will say, if you are really doing this particular service and you use this code, we will reimburse you more money than if you use the 360, which is the general surgery code. This gives hospitals a little bit of leeway on how they decide to code these things for reimbursement. And some hospitals will add in modifier codes. Now, modifier codes basically are different rules for different types of billing. You may have a modifier code that talks about whether a procedure is bilateral, which means it's being done on 2 different parts of the body, or like a breast. You have a right breast and a left breast and a right breast, so you might do both of those in one procedure. Well, that would be bilateral. And you could have something like there's certain items that you can do in an emergency room, where if a person needs to go somewhere else, like to the radiology to get a test done there, or just anywhere else, you may have a modifier that you add on to that so that you can get covered. Now, I have seen a few articles. There's one video that I've seen here on YouTube where basically a person is complaining about the charge master. Um, Trust me, if you're complaining about a charge master, you have absolutely no idea what you're talking about. That's just my opinion. Now, does that mean that charges may be too high or aren't high enough, or different kinds of things with charges? Does that mean that maybe a person may look at some charges and think that certain things are overinflated? Absolutely not. it's not the charge master's fault. It may be the fault of the people at the hospital who may not understand what it is they're doing, or they just might be doing the absolute right thing. When you start talking about costs and how, hospitals decide how they're going to price things out, it's quite possible that a hospital has very high costs. A hospital in New York City and Philadelphia, Dallas, they're going to have higher costs than a hospital in a small area that may have 50 to 100,000 people. The costs are just much higher, and cost can be anything. Cost can be the cost of electricity. It can be the cost of paying for the doctors, the cost of malpractice, the types of services that they offer. Malpractice differs for each one of those people. So it's not the hospitals per se. It's not the charge master. It's what different hospitals have to deal with. So this is the first video. I'm going to do a few videos talking about different aspects of charge master as we go along. But I wanted to get this first one out there, talk about exactly what a charge master is. Now, I'm going to have some links below of different articles if you want to check them out. I've written articles on different aspects of this, and they talk about pricing, and they'll talk about what it is, and they'll talk about charge capture processes and all kinds of things. But I really wanted to get this first one out there talking about what a charge master is, because I think there's a lot of misinformation. There's a lot of people who just get it wrong, who aren't in healthcare, and they're misrepresenting it. And probably a big problem with this is that there's a lot of people in healthcare who have absolutely no idea of its real purpose. They may have heard the name, but they really don't know the purpose of it. So this is going to be my goal, to try to help educate both people outside and inside healthcare of what it is. And trust me, there's a lot of people who know what a charge master is. There's a lot of qualified people out there who do this work, but there's not a lot of videos about it. There's really not a lot of information anywhere else on it. I'm going to be the guy. So there you go. I hope you have a great day, and stay tuned because there will be more coming. Thank you very much. Have a great day.